Hi, this is Dr. Kevin Smith. Thank you very much for checking out this video on hidden secret number 20 of why you can still have low thyroid symptoms even if your lab tests are normal and even if you're taking thyroid replacement hormone. In this video, in hidden secret number 20, we're going to talk about low thyroid binding globulin that leads to a high percentage of free fraction thyroid hormone. Now, in the past video, we talked about thyroid binding globulin, which is a little carrier protein that transports thyroid hormone from place to place in the body. Now, most of the thyroid hormone that comes out of the thyroid gland is T4, which is inactive, and it has to be transported to the liver and then to the gastrointestinal tract to be converted into T3 so your body can use it. There's two different types of thyroid hormone. There's bound and there's free. So bound thyroid hormone is bound to thyroid binding globulin. The free thyroid hormone is not bound. Most of the thyroid hormone is bound. And as we said in the previous video, thyroid binding globulin are analogous to little taxi cabs that drive down the street and picking up their fares and transporting them from one place to the other. And the thyroid hormone can't just do this on its own. It needs this little binding protein to be able to accomplish that. So if you have low amounts of thyroid binding globulin, if the TBG is too low, what's going to happen on your labs is that you will have a high T3 uptake. T3 uptake is the test that actually measures thyroid binding globulin. So you have high T3 uptake, you will have high T3 and high T4 with a normal TSH. Now, why would you have high T3 and high T4? Because T3 and T4 rely on the thyroid binding globulin to get from place to place in the body, and if you have an insufficient amount of thyroid binding globulin, what's going to happen is that it cannot transport the thyroid hormone, and subsequently you'll have too much of it. It won't be taken to your cells where it could be used. So you would think that if you have this problem, if you have a high amount of T3 and a high amount of T4, that would lead to hyperthyroidism, but it actually doesn't. This process is very slow, and it happens over a long period of time, and what happens is that your cells have receptor sites on them that are just slowly and gradually being bombarded by excessive amounts of thyroid hormone. And what that happens is that those receptor sites eventually become desensitized or blunted to the thyroid hormone, which gradually leads to low thyroid symptoms. So again, you would have a high T3 uptake, a high amount of T3 and T4, and low thyroid symptoms. And those would include things like depression. You can't get a good night's sleep. You're gaining weight. You can't lose weight even if you're dieting and exercising. You feel cold all over, especially in your hands and your feet. You have thinning or dry and brittle hair, or you've got cracked fingernails, or you've got alternating constipation and diarrhea, all the different hypothyroid symptoms that we talked about. Now, what's the cause of this problem? Ultimately, it's caused by an abnormal metabolism of estrogens. And in women, it's very common with metabolic syndrome. Metabolic syndrome is due to being overweight that also causes high blood pressure and insulin problems, leading to type 2 diabetes. You could also have insulin resistance, where the cells of your body are no longer able to take the insulin and allow it to shuttle the sugar molecules out of the blood into the cells where it can be used for energy. So ultimately, you would have elevations in testosterone with these women that have metabolic syndrome, and ultimately it's testosterone that drives the ship. So we have to support the patient to make sure that we're getting sufficient amount of clearance of testosterone so we can allow the estrogen levels to normalize again. And then we would have a normalization of the thyroid binding globulin and bring those hypothyroid symptoms out of the picture again. Well, I hope you enjoyed this video and I hope you learned something. If you have any questions about this, please subscribe to my YouTube channel and please tell a friend. Please feel free to communicate with me through my website at integratedmetabolic.com. And again, thank you very much for checking out this video.